All right, so welcome everyone. I want to thank you all for coming tonight, and I know a few people are still going to make their way in. I am Dina Gilt-McCullough, and my day job is Chief Executive Officer of Northern Insuring Agency, and this is Dana Jeweler, and Dana is an Operations Manager in HR at University of Vermont Health Network, CVPH, and we are both members of the You Matter 988 Mural Planning Committee, which is a subcommittee of the Clayton County Coalition to Prevent Suicide. Coalition meetings are open to everyone, and you can just let Bonnie know, who is right here. If you'd like an invite, they're all virtual, and anyone is welcome to attend, and there may be some coalition members here tonight. If so, we thank you very much for attending. A few quick housekeeping items before we get started. As you came in, you know where the exit is because you came in that way. Lucas, that sounds, I hear you. And there's also bathrooms as you go out. They're just a little bit around the corner this way. We ask that you mute your cell phones. You don't have to turn them off. We all know how that works. You can take pictures of the slides, no problem, but we can also send them to you if you want them later. We just need your email address, which we got on the way in, but we need to know who you are and that you actually want those. And we are videotaping here. If you have any concerns about that, let Miss Dana know. And also, please ask questions at any time. Thanks, Dana. Actually, you know what? Let me take a minute and do a quick switch. Check. Is this on?
I turned this on.
You want to turn it off now?
Oh, is it on?
Check that. Is that good?
Yeah.
No.
Look for the green light.
Green light.
Is it on? Green?
Green, green, green.
You can just wait for the board. That's fine.
Then I can
You
go
gotta get
nice
back to
and
the
loud
board
too.
when needed.
Yeah, there you go. Let me see. Let me be your recorder.
Yes, tell me, Dina, tell me your story.
Tell me your whole story. I know, right? As Lucas is getting that going, but so I wanted to share a little bit about my story as we're making sure that everything's working here, and it's really an ironic story because it was 19 years ago, just about this time that I was here in this same auditorium. Mike Mannix, who was then the executive director of the United Way, invited me for the first time to tell my story publicly about what had happened with our son Sean, who had died because he got in trouble for drinking at the school prom, and he made a permanent decision to a temporary problem. I'll tell you, Mike really started my journey on healing, and a lot of that was because I found that talking publicly about suicide really broke down the stigma for me, and it felt like I wasn't holding on to all of that myself. So in the last 2 decades since then, and you know, it's really hard to believe, but I've worked hard to keep my kids safe, both of which are here tonight. Mark, who's a great partner to me, survived a marriage, which is really hard to do in the wake of a terrible death, and to advocate for suicide awareness. I've learned that suicide really can happen to anybody, any family, anywhere. Doesn't matter who you know, how much you love each other, how much you watch each other, because you can't watch people 24/7. And then COVID happened, and in COVID, I retreated, a lot of us retreated, and in 2023, we had a string of suicides locally, and that really was, at that time, a strong sense that my eyes were reopened to, hey, we can do better as a community, and I can do better as a person. The August 23 vision was to create a mural of 98 resources to increase suicide awareness and to break the stigma. But what happened was so much bigger than that, a call to action. I'm humbled beyond words with the outpouring of support that we've had and the feeling that this is a progressive community on the cusp of something tremendous. Dana, can you tell us a little bit about you?
Yes, Dana Jeweler. I'm also a suicide loss survivor. I lost my father many more decades ago. I was 8 years old when he passed. And I've always been aware of stigma. That's my passion, is to erase the stigma. I work at the hospital and I do a lot of mental health awareness and different community activities to help erase the stigma. I want it to be where if you come to a doctor with mental illness, you're going to be treated the same way as you have a cardiac problem or you have diabetes or any other health-related. Mental health is health. And I'm very passionate about the Evening of Healing. Many of you, I think, have attended Evening of Healing. It's where we talk not only about suicide, but other trauma that you've learned and grown and you've gotten stronger. So those are passions of Dina's, mine, and many others in the community. Sally Meisenheimer is here. She's one of our community. Bonnie, of course. We're going to show in a moment a time-lapse video of how the mural has progressed. Did anyone drive by daily and see it each day? Do you remember the temperature you saw on your dashboard? Giovannini Bucci was so amazing. She's going to have a baby in October, and she's up there on that lift in that heat every day, day in and day out. Amy was right there. Bonnie was right there with support, with the tabling, with all the 988 information. So Amy Guglielmo, could you please stand? Amy is our director. We could not have done any of this without Amy's direction. We approached her and said, hey, this is our idea. And wow, she drove this ship and she had every base covered. What, there's 24 murals now, or there will be soon, between Champlain and Keysville. And she has orchestrated, with Julia Devine and her team have orchestrated all of those. Giovannina Bucci could not be with us tonight. She has a gig. She's also a musician. And I want to recognize Jody Brunner. She did our art. She did the design on here. She took G's design and ran with it. And the program, did she do the program as well? She did the mural map. Yes, the bumper stickers, mirror clings. We have bookmarks, mirror clings, window clings, to put all over to spread the message. Another unsung hero was Abby Duquette. She was their intern, and she was there every day with G and Amy and Bonnie, painting and doing everything she could and gaining so much knowledge. I'll turn it over to you.
All right, great. And I also want to introduce the subcommittee in addition to Dana and I. We have the fabulous Amy Colleen here. Thank you, Amy. Bonnie Black, who we mentioned too. And then there is Jen Boyer right here. Thank you so much. We couldn't have done it without calling ourselves the Mighty Five. And I think at one point Amy suggested to keep it small. And I think that was a great idea, Amy, because more voices, there was already plenty of us to weigh in.
And we're so quiet.
Oh, yeah.
Reserved.
I know. Jay LeBron is here tonight, and Jay, you, and Joe Leonard, Lucas is here, the entire Plattsburgh City School Board. I don't know if there are other board members here tonight, too. Yes, I thank you very much, Nikki, for being here. The partnership during this past year, and it has been a year, Mayor Rosenquist actually, I think we all came together early on in the winter months when it was just a tad bit colder than it is now, and for making this available tonight. We really thank the school board for everything that you've done. The Clinton County Community Services Board, I don't know if anybody's here from that board tonight. Maybe Mike? Not yet? Pass. They awarded us an incredible grant for the opioid settlement funds, and I know Rochelle is supposed to be here in a little bit. She will be here, but we want to make sure that we recognize that board for their efforts and for granting us such a large amount. And just as a note, the Suicide Coalition actually doesn't have any money that flows to it, so we're supposed to have a coalition, and there is no money that flows through Clinton County to the coalition. So I want to tell you, Bonnie does all this as a volunteer, and we are very, very grateful for the work that she does, because I know that Dana and I look at each other, we're like, we could not do all the trainings and everything that she's doing. It's really, we talk about labor of love, right?
Absolutely.
With the Community Services Board help, I think our hope is that as we do more and more education within our community, that we will be able to reapply and we will be making a difference here, because that really, you know, look, where money goes, information flows, and that's really what we need to see happen.
Okay, do you want to show the video?
Yeah, I think so.
Yes, and then we'll go on to a few more things.
And now to enjoy the time lapse.
There are two of them.
Okay. Amazing how fast that gets made.
I know. That makes it look so easy. This is only, what, a minute and a half long, 2 weeks later?
Well, we got 2 videos to watch, time lapse.
Okay.
Giovannina does these on a lot of her murals. She's done murals at the hospital, she's done murals at Harrigan's ice cream stand. She's doing one on Bailey Avenue, Glasgow Elementary School.
And if you look at the bottom, what Amy did here is she wrote little messages in all the little squares, and then we had community members that painted over those. And some of the people came and they wrote their own messages, their own private message. So it became very meaningful because it would be like you would always know it was there because it was preserved. That sounds like music. I'm like, where is that coming from? I think she had it. She did, I think.
So we may not see the messages anymore, but we know they're under there.
Yeah, that's great. Thank you very much for showing that.
I'd like to recognize a few very special people. Billy Jones, thank you so much for all you did. You are always there for us, and we really appreciate it. As I mentioned, I work at the hospital, so I wasn't able to be at the painting very often, but I did stop by and you were there, so I got my hug. And that was wonderful. I really appreciate all your support. Chris Rosenquist, thank you so much. You have done so much for the community and you continue to do it. We are very grateful. This is a very...
And we will miss you.
Yes. Michael Cashman wanted to be here. He had to be in a meeting. These people have to work. Not right. He was very supportive. He wrote an editorial. He did came and painted and was just there to support us. The United Way. Wow. Did they really come through to us? As you notice, we aren't a 501c. We don't have funds running through us. They stepped up and said, yes, we'll be your fiscal agent. So all the donations and all of the financial things went through the United Way. Wow. It was a heavy lift. It was money coming in, it was paying bills, it was doing things. Holly LaFountain, the business manager at United Way, was my right hand. I was there, okay, I approve this bill, pay this, do this. Gave us statements every week. It was a godsend. Northern Insuring. Not only painted and donated, and if you need a project run, Amy and Dina, oh my gosh, every dollar. We joke with your MBTI or Myers-Briggs. I'm a very go with the flow, just, oh yeah, I'll get to it, and I do it, right? Oh no, the agendas and this and this and this. And we make a nice balance. We'd like to thank the U First Credit Union and the corporate and employees both donated. Casey, I believe, is here. Thank you, thank you. Liquor and Wine Warehouse. Steve and Carol are always donating for all the causes in the community. They're huge supporters of Plattsburgh. Our 2 birthday girls, Carrie Lavasser and Michelle Armani Munn, both devoted their birthdays in a different way to supporting the mural. They raised money, they donated money. Michelle had a milestone birthday and she said, don't bring me a gift, I want you to give money to the mural. And it was very nice. Taylor Rental were very supportive. Chris and Ashley Akey, we couldn't have done it without them. Very supportive.
And also to Warren Tire Service Center, and I don't know if anybody else is here. Your dad, Ed, is not here, but to Barb and Jen, they are like the best partners ever. In fact, they have ruined all mural creation from here on because their entire team would take the tent up, put the tent down, move the paint cans, wash the stuff, feed Jen, or people come out and feed G. Every day she would get fed, and like they are forever spoiled because they got such great treatment here. We're very, very grateful for a 140-foot wall. So thank you very, very much. Mommy in medical, Andy Sepsi is here, and we've had some conversations that we probably never would have had if we didn't have this mural that brought us together. Thanks for being here, Andy. From Champlain National Bank, both Jackie Halleck and Steve Calcio are here, and thank you both for supporting this effort. Appreciate you. Community Bank was going to be here. I know Jim Snook had a late commitment that he could not be here for, and I don't see Kent Backus, but he may sneak in yet. To my good friends at the Northeast Group, Mike Carpenter and Betsy Vicencio, thank you. Thank you. Appreciate everything that you do. And for the Bedrogi, Spencer, and Bouchard families, and I know Rob is here, you really brought this mural to life. So Cynthia is here. Please tell her that we're thinking of her. And it's not enough, really, but we think about you. And this really was the reason why I said, I'm going to get on that coalition call and say, we need to make this happen. We need to do better.
Absolutely, absolutely. We raised almost $48,000 in contributions. 26,000 of that was used towards the mural creation, including paying our artists, consultants, purchasing supplies, printing bookmarks, stickers for libraries and schools. We printed 1,800 bookmarks so far, maybe more.
Oh no, we printed 8. We're on our second run of 8,000.
Oh,
so we
8,000.
printed 8, and now we've done another 8. So the first 8,000 went to all the schools, and now we have some out here, but they will also be all given away this fall again.
Yes, so all the schools, we have a friend, Ali Rosenbaum, who works at Saranac Central, and they have an inter-office mail for all the schools, and we got bookmarks for all the students, K through 12, throughout the county. The remaining 22,000 will be used for community education resources and to continue to raise awareness and break the stigma of suicide in Clinton County.
Yeah. And with that, I want to turn it over to Bonnie Black. Bonnie is the chair of the Clinton County Coalition to Prevent Suicide and also the coordinator of the county post-vention team. Bonnie?
Thank you, Tina. 988. How many of you knew about 988 before we began painting the mural? Well, yes, if you're in mental health, you should. But so about 8 people. 988 has been around for 2 years as of July 16th. 988 is a heavy lift. 988 is the 911 for emotional crises. The FCC and the National Suicide Lifeline worked together for about 4.5 years to get legislation through Congress to allow a 3-digit number. Because even us professionals, the number was 1-888-354, because we couldn't remember it unless we were handing out a card, a magnet, whatever. Okay? So it was very obvious that for mental health, for suicide, we needed to take action. Congress passed a 5-year plan, but it has to be funded every year. And there's the rub. As a board member of the American Foundation for Suicide Prevention, I have gone down to Washington, D.C., visited our representatives. I've gone to the New York legislature and visited representatives. Thank you, New York legislators for being in your offices. I can't say the same about Washington. I will stop there. But we have to advocate to maintain 988. Just because it's on the books, to have the 5-year kickoff funding, it will not happen unless the Senate and Congress agree to fund it. So it was an incremental increase, and the reason why is to set up regional call centers so that when someone calls 988, They actually get a trained operator, trained in assist, which is the gold standard for suicide intervention. It's a 2-day training. They're trained in that, and they know their local resources. Our local call center got online last November. It takes about 15 weeks to train the operators. That includes having a supervisor with them the last 4 weeks while they are answering calls. And then it has to continue. That startup funding for each regional call center is federally funded. Once you're up and running, good luck. So the FCC has put in for this year's growth that we will all have a couple cents put on our phone lines, just like we have for 911. We've been paying for 911 for years, whether you know it or not. Yes, you're paying a couple cents every month to have 911 access. So what our movement this year was to advocate that we have those few cents, hoping to be equitable, but asking for 1/3 of the money, to get continuous funding for 988, like there is continuous funding for 911 operators and call centers. So, you're a member of the coalition, periodically you get emails from me saying, here's the letter, go forth and advocate, because we must continue this. If we lose 988, we will lose more lives. It is statistically driven. In May, there were 610,378 calls, texts, and chat messages this year. The year before, at its inception in August of 2022, there were 47% less. People are using it. People are calling 988. Lives are being saved. We have to recognize that. Is a life worth 8 cents on your monthly phone bill? And I think all of us in the room tonight, I'm talking to the community, so to speak, all of us in the room tonight agree, yes, a life is worth so much more than 8 or 10 cents a month. So we have to keep that funding, get that funding in place. The new movement now is to geolocate. And what that means is, just because I have a 518 area code on my phone, if I'm visiting a friend in Manhattan, I shouldn't get Plattsburgh resources. I'm in Manhattan, I'm in a crisis. It's not going to tell anybody that I'm at 136th Street and 8th Avenue. It's going to say I have a 518 area code phone, patch me to the regional call center for the 518 area code. I know some people were thinking about privacy. Oh, geolocate, does that mean they're going to pinpoint where I am? Absolutely not. My daughter carries her 917. She's very proud of that area code for when she was in college. She lives in New Hampshire. What is she going to do with West Side New York resources in New Hampshire? So these are the growth steps that 988 is going through. So we have 3 more years of foundational funding that we need to keep our Congress passing and saying, yes, we believe in this. And then we, as citizens, need to pick it up like we did 911. I hope that makes sense to people. So what does a call sound like when someone calls the 988? We've got an example, and Barb is going to read that.
Here's a story of someone who called 988 just a few months ago. Addison called 988 when she was in crisis. She had arrived home after a stressful day and had no one to talk to. Her suicidal ideation flared, and she felt increasingly lost. I was like, this is it. I don't know what to do, she said. But then she dialed 988, and the operator at a call center in Tennessee, where Addison lived, engaged her in a long conversation. It helped me calm down in the moment and recognize where I was at and be aware of my surroundings. I would say it saved my life because I didn't know how far I would take my suicidal thoughts, Addison said. It sounds like I'm supposed to say it, but I don't know if I would be here if it weren't for 988. That's why she's sharing her story. I would not hesitate at all to call or text 988, she said. There's nothing to lose from reaching out.
Thank you, Barb. So that's important to remember. There's nothing to lose for reaching out. Anybody can reach out. It doesn't have to be the person in an emotional crisis. It can be a family member. It can be a friend. A concerned coworker. It doesn't matter. It's there for all of us. Are there any questions about 988? Megan?
I've worked with teenagers in the past that have been concerned when we talk about geolocation. They're concerned that if they do say, rather than taking steps to end my life, that some law enforcement might show up. Is that something that does happen?
The question was, does law enforcement show up if you call 988? Actually, I just referred to my notes. It's actually what we're doing is geo-routing, not geolocation. So geo-routing. The answer is no. 988 is not connected to 911. It is totally separate. 988 is the National Suicide Hotline that has existed for like 13 years. They just changed their number to 988. And they never have called law enforcement. Okay. As I mentioned, is call 911 if it's imminent risk. I'm standing on the cliff. I'm now 3 inches past the edge of the cliff. Yeah, we're going to get help there. Okay. Yes, they're trained in how to talk down, but you're going to need somebody to truly de-escalate that imminent situation. Okay, thank you for that, especially teens. Now remember, 988 is not just a call. It's a text. You can text 988, and there we have a younger generation. That's what they're going to be comfortable with, texting 988. And if you go to 988lifeline.org, you can chat live with a 988 operator. So it truly is accessible. And of course, it's got TTY for hard of hearing and deaf. Any other questions? Andy?
Yes. How can an organization...
Wait a second till Jen gets with the mic so everybody, so we don't spend time with me going, and he said.
So how does an organization integrate 988 into an EAP program?
Well, your EAP, in theory, should know about 988. If they don't, seriously give me a call. Have Teresa give me a call. But you can do things, and these are all free, put up in bathrooms. 988 posters. We happen to have this in every bathroom in our church. We have many doors, we have many bathrooms in my church. And they're there. Head Start functions in our church building. They use those bathrooms too. I had a conversation with someone when I first started putting these up, and they said, oh, well, you know, Head Start's here, but A, they can't read, they're 3. But for their parents, for the teachers, they may need it. Anyone of any age can call. But you can get posters, you can get hand sanitizers, you can get cards, brochures, all kinds of stuff is on my table. And you personally, anybody, can order it from SAMHSA for free. You're just going to have to wait 10 to 12 weeks to get it. They're always on back order. But that's a very good question, and I think any business that has an EAP, having come from that field for 30 years, you better talk to them. They gotta know what 988 is. And maybe they go in and do a training on 988. Because EAPs, in theory, are 24/7. Not all EAPs are. So you need to make sure it's not just an information and referral EAP. So that's why 988 is essential at work. We also have information on what industry codes where suicides at work are the highest. Construction, quarries, mining, Ever think about that? Those are your top 3. But veterinarians fall in there too. In a training with me, you'll find out why. But yeah, we can look at our industries and say, oh, there is a greater risk. So perhaps I need to bring in some suicide prevention education. And that's mainly free through our council, on our coalition. Other questions that might be about 988 at this point? Okay. I'm going to turn it over to someone who's not here yet. She's having a CSB meeting at the moment. Should I tap dance now?
One thing I wanted to add was we have the window clings, mirror clings, that you can put in the restrooms that have the depiction of the mural, and it has the 988 information. And we're putting those in the hospitals and schools here too, as well. You can put them in businesses too.
Which on the group.
I can talk about postvention.
Yeah, if you could talk about postvention, and then she'll be here, and this is a very organic meeting.
Yeah.
Another question.
Andy, go for it.
Andy,
Andy, then I'll tell you about postvention.
Yeah.
So we are having our second annual employee health fair coming up.
I'll come.
All right, and I was wondering if you would be willing to come to be able to roll this out to our full
Yes.
staff.
Yes, yes, I can.
Okay.
Yes,
We'll have to exchange numbers after this.
yes, we shall. Mike, you have a question?
Yeah, can you hear me? I can yell.
I thought that they still gave me a mic.
So they're gonna give it to me too. So now you're really, Dina told me that I didn't have questions, so I had a bunch of them written here. So, but just for you, you mentioned 2-day training was the gold standard, I think, for 988 operators. Is that available to the general public? Anybody can take it? What's it cost? And is there a shortened version for people that just wanted to have the basics if somebody came to them that was in crisis and they weren't ready to call 988?
Thank you for asking. It's called ASSIST. It's 2 days, and the training is about suicide intervention. So whether it's somebody at work or somebody in your life is near that imminent threat point, you are trained. Not everybody winds up completing the 2 full days because suicide's too fresh for them. So I typically say to an organization, if anybody has had a suicide in the past 12 months, please do not have them come, even if they want to. It's going to bring up way too much, okay? And it costs you nothing. Suicide Prevention Center for New York gives me a nominal stipend to go around the North Country, which they consider Watertown to Plattsburgh, the North Country, and do that. Anything, I think the next step, the lower step could be, the lowest, would be the 3-hour safe talk. It's created, it's also evidence-based, as ASSIST is, but it's created by the same company that does ASSIST. And it really gets you to learn how to talk, how to ask the question, because there's only 2. Are you thinking of killing yourself? Or are you thinking of suicide? There's no other question to ask a suicidal person. You don't ask about anything like that, okay? So you're taught, you're trained, you practice it, you watch. It's interactive in the fact you have videos that help, etc. You get a lot of information on community resources, but the 3-hour safe talk, the 2-day ASSIST, you will be very well trained. And in theory, we say do this every 2 to 3 years with your staff, and they're refreshed. Other questions? Okay.
I was just curious, we have employee wellness is top of mind for us. We constantly do different things and have it in conversations. So what else can we do as employers in the community to make sure that our team is okay?
Well, I personally would consider, and this is my thought, having your HR and people who employees connect with Like when I do school trainings, I say, get the bus drivers in for this training. Get the janitors in for this training. Bus drivers see those little big people every day. Janitors, they're the ones hanging around the hallway when those lonely, isolated, feeling isolated kids are still getting their act together to leave. So I would say HR and the connected people and get them trained maybe in something like mental health first aid. That's a full day, but that's a really solid training also. And right now, because of the grant, it would be at no charge for that either. Let me mention postvention. Typically, we hear prevention. We know that happens to stop someone from acting on a suicidal thought. Intervention is at the moment when someone is exhibiting behaviors and most likely going to act on them. Postvention is for suicide loss survivors. That's what we term the families, the friends, the co-workers of the person who has just taken their life. Our postvention team in April of 2017, Clinton County Legislature actually formally acknowledged the Clinton County Suicide Postvention Team. We are a group of trained in postvention people who get deployed at the request of the bereaved. We're not an active postvention team. We would need much more education for that. I am applying for a grant for that, but that would be called by the coroner or law enforcement at the scene. So we're delayed. We wait till someone contacts us. I'm the coordinator. I get the call. There are brochures on our postvention team out there. And then I triage based on what the person wants. Many times, I'm finding recently, when it's a non-business event, it is a phone conversation. Because there are lots of things to do when you have just lost your loved one to suicide. And depending on the means will be depending on some of the things you have to do. And so we can guide you on that, we can advise you on that. We can be there with you if you want us. We come in teams of 2, unless it is a full family, and then our full 4-person team will be deployed. The team can include someone who has lost a loved one to suicide, a faith leader, depending upon the desire, whether to have that or not, a peer, or a licensed social worker or mental health clinician. And we just re-upped our training in May and added a couple new people, which is so nice. Because we've had people move out of the area, and it's like, I can't call Florida and get Tom back here. You know? So we have a postvention team. AFSP, American Foundation for Suicide Prevention, also has what's called healing conversations. It's a one-time connection. It can be done by phone, virtually, or in person. And you meet with the person, you're trained on what to do, to meet with the person who wants to have a discussion. Now, this can be months after. I had one person connect with me, it's been 25 years. And therapy's just not working. And that's fine. But she reached out. And we've connected, because I'm trained in that one too. So healing conversations is also very important when the person who has gone through the loss is ready to have a one-on-one conversation directly about the event. Okay? None of this reviews the event. That's traumatizing to keep talking about the event. We don't do that. We do it in a clinically appropriate manner. We also have, on Monday, October 7th at 5 p.m., our coalition is beginning the first suicide loss survivor support group. There are bookmarks out there that you can take, hand to people who are lost survivors. And the reason why it's not starting till October, I have to go to Arkansas in September for 3 days to get trained, evidence-based, on how to run it. We didn't want to do it just with, hi, let's gather and have some coffee, like a 12-step support group. We want to do this right. We want to do it, we've had to wait, but we're going to do it so people will get help. So that's sort of exciting. We've wanted this for almost 2 decades. I mean, 2007 is when we really began this coalition. It has been a labor of love to all of us in it. But I'm very pleased and excited about what our county is doing to support people in crisis. Don't just come up here, it's your turn.
No sitting down on the job.
No sitting down. She had a community services board meeting. This is why she's a little late to us.
Hey there.
Hi, everybody. I apologize. I was at the community service board meeting, it's my meeting, so I can't scooch out usually. My name is Rochelle Gregory. I'm the Clinton County Director of Community Services, which is a local government unit for the Office of Mental Health, the Office of Addiction Services, and the Office of People with Developmental Disability. So I understand we're here today to recognize the great work the community did and this coalition did on the 988 mural, and what a wonderful, wonderful message to our community so that people know that we care with a simple message. So letting everyone know that there are people out there that care about their mental health and their general well-being, and there's a 988 number for them to call when they're in an emotional crisis. So just to let you know what we are doing in the community to support those that are struggling with emotional crisis or with a behavioral health concern. The board is working very hard with our community agencies, and we have a whole host of services that are either already implemented in our community or about ready to be implemented in the next year. You take a deep breath there for a minute. So, just so you know, you can ask me any questions about these services and what we have available to those family members, friends, and community members that are struggling. So about 3 years ago, we implemented a local mobile crisis team. It's a 24/7 response in the community that can be called at any time in a crisis for our community. We also implemented something called the Law Enforcement Mental Health Referral System, and that is a program for our law enforcement partners to do a referral so people can be connected in the community to behavioral health providers and people that can assist them. So it's a direct referral to an individual where we can respond within 48 hours, find out what services they're connected to and who's best to support those individuals. Also, we have a systems of care. So systems of care is to support children and families in our community, and that systems of care has implemented a team that reviews the highest needs children in our community and families. So when they come across barriers in our community to services and to mitigate their crisis, if there's barriers, we can identify those and begin working on them and help think outside of the box with local leaders that can change policies and can access funding to help mitigate some of those things. In addition, in 2023, we started a children's crisis resident. Behavioral Health Services North, one of our partners, started a residence for kids, and this is a place for kids to go to divert from the emergency room or to step down from the emergency room to transition them more smoothly into our community and connect them with the resources we need. Also, you may be aware, 988, which is on your mural, the Directors of Community Services regionally advocated to have a local 988 call center. That's Essex County Mental Health Association. They're our local call center, and this year they went 24/7. So know when you're calling 988, it's someone local that knows our community, that knows the resources in our community, and knows in a snowstorm who best to send to Lion Mountain, right? So that was very important to us. Am I breathing really hard? No.
I thought maybe you want to hydrate.
Thank you. What else? So we also have a crisis intervention team. So very excited about this. We implemented it in 2024. 2023. We did crisis mapping throughout our community to find out where the gaps and needs were. And we partnered with law enforcement to train them in psychological first aid, so they have the tools to respond to people in our community in a behavioral health crisis and to build that partnership and resources so we can respond with the right people, the right tools at the right time. And sometimes people in crisis, in emotional crisis, law enforcement may not be the best response, but we want to de-escalate those crises, give law enforcement the tools to do that, and make sure they have a partnership with our behavioral health community partners so we can help intervene and show up on the scene for these individuals. In 2024 to 2025, we are implementing several very exciting programs. One is home-based crisis intervention. Community Connections of Franklin County worked with us to do a regional grant. They are partnering with our friends NAMI. We have a NAMI representative right here who are wonderful in our community. But partnering with NAMI to respond in the community, in the homes of youth that are in crisis to help their families de-escalate the crisis and connect to resources they may need. So again, emergency room diversion, which is really important in our community. BHSN will also be opening between the end of 24 and 25 an adult crisis residence. So again, similar to the children's residence, diversion from the emergency room and step-down services coming out of the emergency room, connecting them and stabilizing them in the community. Critical time transition program for children. Mountain Lake Services in Essex County, again, is launching a regional program that will deal with children and youth in the emergency room. So sometimes because we don't have the community services, children get stuck in the emergency room for long periods of time. It's not good for their mental health. It's not good for trauma. For these youth sitting in the emergency room, it's not the best place for them to be. So Mountain Lake Services is going to work with those kids and transition them back into the community. And they're doing this in conjunction with a transitional residence. So short-term house to help these individuals back in the community, step down and stabilize in our community, especially those with complex needs. For example, co-occurring mental health and developmental disabilities. So if you might not know this, but those individuals are very difficult in our community to wrap services around, and those are the ones that often are in the emergency room. We also went 24/7 with 988, which I mentioned, and we created a regional disaster mental health response team. So this team will be able to respond to any tragic incident in our community, and we will be able to work with families, those affected, loved ones, caregivers, to respond to a crisis, to be on the scene and help do some de-escalation and provide resources to those individuals and families. We also can respond to first responders that are dealing with the incident and maybe struggling with the work that they're doing on the scene, the very stressful work. So that is very exciting to me as well. We have had our 4th regional mental hygiene forum. This is a partnership with OMH, the Office of Mental Health, and the hospitals to work with the emergency room crisis for behavioral health individuals to make sure we're getting the right information to the hospital when someone is experiencing a crisis. Oftentimes when someone's in an emotional crisis, they're unable to communicate the full picture of what led to that crisis and what people are involved that may support them. So we want to get the right information to the hospital if they're being transported by law enforcement or someone else. And we want to make sure that the emergency room is communicating to our partners in the community so we know what the stabilization plan is, what the discharge plan is, and what we have available to those individuals coming out of the emergency room. Finally, we'll be opening a intensive crisis stabilization center. That's with our partners at Champlain Valley Family Center, and it's a 24/7 crisis center to drop off individuals who are in crisis to not go to the emergency room, but go to a place that has peers and behavioral health specialists that can stabilize, provide proper medication in our community to make sure that we are doing the right services at the right time with the right people.
That's great.
So I know that was a lot. If anyone has questions, please feel free to ask me about those services. But these are the things that we're doing, the Community Services Board is doing to fill the gaps in needs in our community for this population and to make sure we're supporting those that need help and find themselves struggling. Thank you so much for having me.
Thanks for coming.
I'm just glad you showed up. I'm like, where is Michelle? She's kind of in the program here. But that's okay. I understand it was your meeting. It's hard to leave too. Any other questions for Rochelle? I don't know if you, are you leaving right away?
No.
Okay, good. I was gonna say, don't leave. Bonnie, we've got some time for, this is really for listening, and I know we want to take some questions. If I can have, I know Amy's here, Jen, you can come up, we'll run some microphones around. This is your chance to let us know what it is we should be hearing in the community. Was that a raised hand, Alyssa? Yeah. All right.
So just thinking through, people are in crisis, usually maybe not with the clearest of heads. So if it's unknown or maybe not recognized that 988 exists and 911 is a more familiar number that someone might call, is there some sort of path that's in place or connection that is made between 911 and 988 to get them to the right resources?
We're going to have Rochelle answer that.
So yeah, so one of the things that we're working on, which is part of the crisis intervention team model, is 911 diversion. So we're working with the Office of Mental Health, we're working with law enforcement to make sure that we have the right risk assessment and 911 is comfortable using that risk assessment to hand it off to 988, because we would rather those calls be handled by behavioral health professionals that understand the resources in the community. So we're not there yet, but yes, we would like to be there, and 988 is all about marketing, right? Making sure that people know that they can use that number instead.
Others. Here's your chance, people.
Okay. I have a question, if I can, about 988. And it's sort of on the heels of the question you asked about children and how familiar they are with using 988. And I'm wondering if, and maybe Bonnie, this is a question for you, is there space at 988 for teaching children what it's like when they call? Like a scenario or whatever. And I don't know if that's something that schools would ever do, but I know that children are really uncomfortable. They're scared of 911. They're scared to make those calls because they don't know what's going to happen. So is that a training tool or a training module that they could actually in groups call 988 and experience what it's like? Or is that weird?
It is not weird. It is definitely needed. Because how many times have we heard with 911 that it was a 4-year-old that called because mom or dad hit the floor with a heart attack or they were bleeding, or 5-year-old. So that's incumbent upon us as parents to also begin to train our children. It's almost like you're never too young. And of course now with cell phones, it's just hit this button and you'll get it. But does it exist? Samson doesn't have an elementary school level video yet. But there is the New York State Office for Mental Health, trainings for school staff that do include at various levels how you can introduce it in a classroom, why it's important to know. And again, just as I mentioned for workplaces, schools need to have these in really all bathrooms. It doesn't matter if it's a teacher's lounge bathroom or a classroom bathroom. We have to get comfortable with the concept of 988. And let's face it, our parents or grandparents would never have thought of 911. They just called Sam at the fire department or their local volunteer sometimes to get the fire department out. So it's time will take, but that does give us an idea that maybe in our Be the One scholarships this year, we ask for videos for elementary, middle, and those students would have to be educated to create an 30-second, 1-minute video for their peers. Thank you, Megan. I love that.
And actually, Jen, you didn't get to ask your question earlier.
Well, now I have two questions because now I want to play off me.
Okay.
So my first question is that I recently had an employee, coworker, come to me and tell me that he had lost a friend suddenly to suicide, and that the family, that they have children and all of this. And at the time, even though I was working on this project, I didn't really know whether can he call and get help, or can he tell the wife or the children, and what kind of services would he be, how would they be helped, I guess, was my question.
Thank you. Yes, as you see on the mural, I could go flipping back a few slides, but I won't do that to your brain. Just look at it after we finish here. It is for emotional support. So you can be the friend, you can be the parent, you can be the child, you can be anybody, and call and say, what can I do to support my family, my friend? You will be coached by the operator on things to do. You may very well be given the Healing Conversations contact number to reach out to, and some other, or the postvention team in our county, and actually Essex County and Franklin County and Hamilton now, all 4 counties are going to have postvention teams. So you don't have to be the person in crisis. You don't have to be the person thinking of suicide. You can be having another kind of crisis, as long as it's not physical health. 988 can do nothing about that. Just wait, your heart will return to beating. No, so we can support at 988 all kinds of requests for assistance. Also, helping students at risk for suicide. That is the real down and dirty, what are you going to do? And as part of that, if it's elementary schools, we talk about the NAMI program, Gizmo. Gizmo is a little stuffed animal. And Gizmo tells stories about feelings. And Gizmo has more words than just mad and sad and happy. Gizmo, over a few weeks, teaches younger elementary school children how to identify feelings. We know lower elementary is where we've got to start with people being educated. What am I feeling? How can I talk about it? How can I talk about it to my parents? How can I talk about it to my teacher? How can I talk about it to my friend? And if we start Gizmo in the elementary schools, which we introduce in the Helping Suicides at Risk module from the Office of Mental Health, that would be wonderful. Then we also have SST, suicide safety for teachers and staff. I have to remember all these acronyms New York State always is putting out. And that's where it's a 55-minute made to go into superintendent's days to fit in that little window of a period. It can be 42 minutes if it has to be 42. It's 55 in a school. And that's a refresher that's available every year. But systems-wise, the schools should have a new, fresh policy procedure, and then it matches. It goes right into that, so that all staff and teachers know process and procedures on that. So I would say our Office of Mental Health has done a very good job. We started pre-pandemic, but boy, post-pandemic, we've gotten our act together. Yeah. Does that help answer?
Yes.
Yes.
Do we have a last question?
Well, Mike had one.
Do you have a last question, Mike?
Last question?
Last question, because we want to go.
Sure,
We need cookies. We haven't had dinner.
if you will let me make a comment first, I will ask a series of questions, and then you can do whatever you want with them. First off, my hat's off to you guys who did this mural. I think it's fabulous. Thank you for letting me be a part of it. I think they deserve a round of applause. It's one of the coolest things. Gregory, thank you for your awesome work at the community services, and it's obvious that since I got off the board, you've accomplished a hell of a lot more than I would normally, so thank you for that. My questions have to do with the 988 number, if you're tracking the calls, are we tracking the ages of the callers and watching the trends that are going on? That's question one. Hang on, Bonnie, I'll give you a couple. Question two is, there seems to be an increase in suicides or suicide attempts amongst older people. And as the population ages, I know we talk a lot about kids because it's volatile, but what are we doing about the older people who are aging, retiring, being alone? Hang on, Bonnie, don't go yet. And last, third, is there, I know OMH throws a lot of money at suicide. Is Oasis on board with understanding that there is an absolute direct link between substance use disorder and suicide, and what is Oasis doing in their own silo to help prevent this?
Okay, she's gonna take your last one, I'll take the other two.
Yeah, so I have the statistics, as you know, Mike, for suicide in our community and overdose data. I want you to know that by far, middle-aged men are the highest suicides in our community and overdose deaths. So I'm in the process of a needs assessment to drill down into that right now to see how we reach that population, and just off the cuff, of course, stigma around mental health for that population. Construction workers are more likely to die of suicide than an accident. I think that's really concerning. I think also given our law enforcement population and corrections, that it's a difficult population to infiltrate or get into. And so if anyone has any ideas, I really have been thinking about that one recently a lot and how we get that population. Although yes, youth suicidality increases, but the deaths by suicide really are the middle-aged men population. So if you want to help me start a support group around that, Mike, I would appreciate it. And also going back to your question, we are doing a mental health forum for youth, hopefully in December. And I think that it's going to be youth-led, and we're doing forums right now to see what topics youth are interested in. And I have school commitments, so I think that one of the things we can talk about is making sure there's that piece around 988 education and what that experience might be like, even having local 988 come and maybe role play some of that. You got me thinking about that. So,
Michelle, what do we consider middle age?
So I think the demographic would be 45 to 64, by far.
Welcome, Justin.
Where do you fall? So I mean, again, that's a really concerning population for me, but I just am not sure how to tackle that yet.
So the other,
If I could just add one thing to that, because, you know, when I asked the question about having you come in for the health fair, all right, when I sat here, you asked the question about how many people knew of 988, all right, 8 people.
right,
Okay, I had no idea. I sponsored this thing.
yes, you did.
Okay, and I thought it was a great idea because of suicide. Now that I'm here, the depth, okay, and the breadth of what this coalition is doing is amazing. So I want to second, hats off to everyone who's involved in it. But how do we get out into the organizations so that we have these posters up in all of the organizations around, the greater area, the North Country, so that everybody understands what 988 means. 911 is muscle memory for everybody. All right, 988 is not something that people even know about. And you talk about middle-aged men. Okay, there's people in those families that might know that that person is doing that, has no idea that 988 is available. I know you said last question, but I just wanted to say.
Yeah, it's your party. I'll answer the other two you had and yours. Okay, so Michael, demographic tracking by 988, they don't do it. It is totally anonymous. Now, if you say, I live in Plattsburgh and, I'm having my 60th birthday soon, they'll make a note of that. But you've just given information. They do not ask any gender questions. They do not ask any age questions. They will, until georouting occurs, they will say, tell me the county you're calling from. That's as tight to where you are, who you are, they get with the question. Does that help on the demographic? Okay. Middle-aged white men have had the highest rate of suicide for years. This really is nothing new. Our county is definitely showing the national trend. When we look at youth, it's the second leading cause of death for 10 to 24. We have to recognize that and accept that, because it has not gone back down to 3 yet. It was the third leading cause of death prior to 2012. Since then, it's been the second leading cause of death. A lot of prevention efforts know we can capture that age group in schools, whether it be primary, secondary, or higher ed. There are programs that have been rolled out for that over the years, since 2015, basically, to address that need. Now, how do we reach those middle-aged men? I think, and Andy, you could maybe carry this, and John, I want you to listen to this too. A Chamber of Commerce that understands the value of 988, that understands the need for suicide prevention and intervention, is going to be where, no matter what we women in business think, is where we're going to meet the middle-aged men. And we got to get that here, have a poster, here I'll come to your wellness fair, here I'll do, and get the information disseminated that way. We can stand, as our mural is, screaming on the corner here. It's not the same as you sitting here and asking your questions about 988 and us taking the veil away from 988 and explaining it thoroughly. So I think it takes advocating on your behalf, on the behalf of your employees, your families, etc., to get out there and do that.
Bonnie, a light bulb just went off. We got to have a store of 988 posters to take to job fairs, because every organization, every business in the community has a job fair, and you can connect with them there.
And that's up to you individually, because SAMHSA limits you to 5 posters at a time, 50 988 cards at a time. Okay, so they don't run out. So really, I can give you, or you can just Google SAMHSA, spell it S-A-M-H-S-A, mental health substance abuse, and then you can order and keep reordering. My trick is, when I get my shipment in, I order the next shipment. So they don't turn back my shipment, but that I'm always getting a flow of materials.
And Dina, we have the mirror claims here.
Yeah, they are here, and actually, that's one of the goals, is that we just had, I don't know how many of these printed, but getting them into schools, putting them on mirrors, at least it is a way to start to get the message out. I tend to agree with you, Bonnie. I think the business community can rally behind this, and I really appreciate the comments. I have to say, as we like to say in my staff, we draw this to a gentle close. I get picked on for that, but that lets you know that we are, in fact, coming to a gentle close. There are cookies and water out front. Lest my staff get stuck with all those cookies tomorrow, please take them for your friends and family. I want to remind you that we do need your email addresses. That is what helps us tremendously. So if you didn't sign in, do that. And then there were, throughout this night, if you want slides, if you want information sent to you and be added to the coalition list, that's another reason to flag your email for us. Like the coalition on Facebook. That is very important to do so that you'll get the information. And there was a list of upcoming events on the back of your program also. Take a look at that. There's a couple of key things Saturday, right here at noon, sharp, part of the Lake City Arts Festival. We will be doing the dedication. Jen will not be here because she's taking a child to college, but Jen and your mom, Barb, and Ed will be here, and it will be quick and festive, and G will be here with us that time too.
Yes, G and Medina will.
Yep.
And Rochelle, if you could pull a lucky winner out of this, we have a You Matter pillow, a book, and a t-shirt for the lucky recipient. Leah Dubray.
Leah. Yeah. So, Leah, you will be able to pick the t-shirt size that you want. So, not the one that you think you want. So, you can have any t-shirt size because this is your lucky night.
Yes. We can't thank you all enough for coming. It was heavy at times, it was humorous at times, but it was always very important. And we could not have done any of this without the community, so thank you all so much for your support.